Hello, everybody, and welcome to this introduction to Care Connect, Alameda County's Whole Person Care Pilot. I'm Dr. Kathleen Klan, and I'm the Executive Director of Care Connect, and I'll be guiding you through this webinar. Before I tell you more about the what and how of Care Connect, I want to tell you something about the who. Hannah is a real person and a Care Connect client. Last year, she was experiencing a very difficult patch and had multiple psychiatric holds for suicidality. She has family in Alameda County, but she was estranged from them and fell into a very dark place. Just last year, she'd been living on the street and had frequent medical and psychiatric hospitalizations. In the medical hospital for 112 days, 100 medical emergency room visits, 21 psych emergency visits, and 5 inpatient psychiatric hospitalizations. Fast forward a little bit, Hannah is enrolled in Care Connect, and she's connected with the Trust Clinic in downtown Oakland, who can work on both her physical and behavioral health needs all in one place. The Trust Clinic connects her to case management services through programs like BAC's Oakland Project Connect, and to Healthcare for the Homeless for respite bed housing. Hannah's full service partnership, or FSP provider, Joe, along with a psychiatrist and clinical social worker at the Trust Clinic, work together on a plan with Hannah to help her achieve more stability. With that new support and a safe place to stay, she's able to have longer periods of being healthy and sober. She's now getting consistent medical and psychiatric care at the Trust Clinic and is already experiencing a much healthier 2018. Now on to the what. Alameda County Care Connect is a 5-year Medicaid waiver from the state of California and the federal government. It ends in December of 2020. The purpose of the waiver is to combat homelessness and disparities within our health systems. A big innovation in this waiver is that it is the first time that housing services could be paid for with Medi-Cal dollars. Only Medi-Cal beneficiaries who meet the criteria can have services directly provided by the Care Connect funding. However, we can use this funding to build information and housing infrastructure to help many of those in our community, and especially to focus on those who have difficulty getting proper access to health services. Looking at the Venn diagram on this slide, we are hoping to work with approximately 20,000 people altogether, a combination of people who have experienced homelessness in the past 2 years, people who are frequent users of multiple crisis systems in our county, and those who are currently in a care management system, such as a Level 1 service team or a full service partnership. Through Care Connect, Alameda County is investing in 6 critical changes in our current healthcare system of delivery. First, we're improving care coordination through bringing social resources such as housing and family networks into a person's care plan. Second, we're working on care integration, bringing together in one place physical health services, primary care, mental health, substance use, and housing services. Thirdly, we want to create a culture of sharing data to enhance our patients' care plans and make their care more seamless and more organized. We plan to do this by establishing a community health record that will be accessible to all the people helping to care for this client. We are enhancing and increasing housing services available in the county through implementing housing resource centers and coordinated entry into housing. We want to reduce the revolving door of acute psychiatric care by increasing the options for people with behavioral health crises in the community. Ultimately, these changes will improve the experience of care and the outcomes of care for clients and their families. In addition to these system changes, we will be providing services directly to some individuals, like Hannah. Each year, 750 individuals will receive case management services directly from Care Connect, as well as 400 people who will get help with housing navigation, 1,100 people who will receive services to help them stay in rental situations, and 62 people who will receive transition out of nursing homes into normal apartments and houses. There will be services that go beyond those 4 service bundles, including housing outreach, housing education, legal assistance, and specific cash assistance with clients moving into new apartments and houses. The funding for Care Connect will end in December of 2020, and following that, 3 infrastructure changes will stay. The data exchange will continue with the community health record in place, allowing our providers to share care plans for their mutual clients. Housing infrastructure that we helped build will remain, including the housing resource centers, as well as 24/7 housing call center and other new housing options and supports. Human infrastructure, including cross-trainings among different sectors and relationships that have developed during the time of Care Connect, will also persist, allowing us to be more in alignment and to have clearer expectations of each other. We will also be able to form new ways to get consumer feedback and their help in designing services that will be ever more responsive to their needs. I want to say a little bit more about what we mean by human infrastructure. Really, it means sharing our expertise. We know that we have uneven expertise within our system, and Care Connect hopes to dramatically improve the ability for people to access services no matter which door they enter. Our medical providers and staff have tremendous knowledge about how to access medical care, but need to know more about how to connect their patients to housing. Our behavioral health providers are well-versed in dealing with mental health issues, but may not know how to get their patients access to housing or primary care services. These discrepancies can be found across all our sectors, and one important goal of Care Connect is to raise all boats so that all of our sectors are cross-trained, knowledgeable, and able to provide or direct their clients to appropriate services in the county's healthcare system, no matter what the patient needs. What is our overall timeline for the 5 years of the project? Startup happened in the first 6 months of 2017. Pilot Phase 1 was from July 2017 and will last through March of 2018. And then we have a second pilot phase from April 2018 through 2019. Scaling up and a plan for sustainability occurs in 2019 and will last all the way through 2020. And in 2021, we will commence wrap-up and sustainability plans. Thank you for taking the time to listen to this presentation. If you would like more information, please visit our website.